We continue with our Be Healthy report. With May being National Skin Cancer Awareness Month, we want to take a few minutes to remind people about the disease and ways to prevent it. Joining us today is Dr. Timothy Chartier, and he's with Hartford County Medical Association. Thank you so much for being here.
My pleasure.
Now, you want to talk about, first of all, the ABCs of melanoma. It's really a good guide to get us through it. If you can just go into and discuss with us, what are the ABCs?
Sure. So the ABCDs of apply to melanoma. So moles or nevi and melanoma. They don't apply to other types of skin cancer. A basically stands for asymmetry. B for border irregularity. C for color abnormality. And D for diameter. And E being an evolving or changing mole. So
A, B, C, D, E, you've got to keep all those in mind. If you've got something that may not look right, use that as a guide.
That's right. So for a mole, a benign mole, you would want to be symmetrical. So if you can draw a line through a mole and one side looks identical to the other, that's usually a benign mole and that's a safe mole. But if one side starts to look different, then that's an alarm that the mole should be looked at. Borders, you want to see borders that are nice and regular. But when a border starts to become irregular or raggedy, then like the screen shows on the left, melanoma, that's an alarm, and that type of a mole should be looked at.
Okay, I want to talk about ways to prevent skin cancer. What is your best advice?
The best advice is to try to protect yourself from the sun, because the sun is the most important cause of skin cancer. So routine use of sunscreen, an SPF 30 or better, applied about 30 minutes before you go out. And if you're going to be sweating or swimming, reapply it every 2 hours. If you're going to be outdoors playing a sport or just picnicking or such, then you want to make sure you try to time it so that you do so early in the morning or late in the day. Try to stay out of the sun during the most intense period, which is 10 a.m. to 4 p.m.
And also with children, we really should remember to put sunscreen on children as well, which is very important.
That's right, absolutely.
Okay, and also we want to show some people some pictures of how to self-check their skin.
Sure. So basically, once a month, you want to stand in front of a mirror and look over your body, and including under your arms, your back, as best you can. If you have someone who can look at your back for you, that's helpful. And if you see something that's new or something that looks irregular, then have your doctor take a look at it.
Okay. Always err on the side of caution. If you see something that may look suspicious and you're not quite sure about it, give your doctor a call, get it checked out.
Absolutely.
All right, Dr. Chartier, thank you very much for being here this morning. Stay with us. We'll be right back.